welcome back to my channel. If you're new here, my name is Krista. I'm an international mama of two, a dental hygienist turned midwifery student, and here on my channel I talk about all things motherhood, midwifery, pregnancy, and childbirth education. So if these things are of interest to you, please follow along and get ready to birth and bloom. Hello, hello, hello. I'm so happy you're here. Welcome back to another video here at Birth and Bloom. So today we're going to be talking all about the glorious, glorious placenta. So in this video, I want to cover some of the basics about the placenta. What is it? What is its main function throughout your pregnancy? What are some of the basic anatomy structures on the placenta? The placenta location, and of course the afterbirth or the third stage of labor, and that is when you, mama, deliver the placenta after the birth of your baby. So without further ado, let's get into all of the basics about this incredible, beautiful organ called the placenta. Okay, so the placenta is the lifeline to your baby. It grows from these cells, and the placenta itself. The placenta is an organ that forms in the womb, aka your uterus, during pregnancy. The placenta is connecting the developing baby, your baby, with a tube-like structure also known as the umbilical cord. And through this umbilical cord, the placenta provides oxygen and nutrients to the developing baby. So the main functions of the placenta is that oxygen exchange from you to baby, that nutrient, baby gets everything they need from you coming in through the placenta and through the umbilical cord. And there's also an exchange to essentially the detoxification, where anything that the baby doesn't need anymore gets detoxified out through the umbilical cord and through the placenta. So it's almost like a filtration system, which is amazing. So let's talk a little bit about the basic anatomy of the placenta. So the placenta, by the time you give birth, it is about 10 inches wide. This is varying obviously from mother to mother, but you can imagine like the size of a small dinner plate. So it's pretty big, the width of it. It's about 1 inch thick, and it generally weighs about 1 pound to 1.5 pounds, depending on you, depending on the baby. So it does vary slightly. So the placenta has a side that is so beautiful, in my opinion. It's the fetal side, which means that is the side facing the baby, facing inward. And you may have heard of it referred to as the tree of life, because here in one of my midwifery books, you will see that the fetal side is beautiful and shiny, and the vessels within the placenta almost mimic a tree, with the veins and arteries kind of spiraling outward. And then the center there, that's what leads to the umbilical cord. So here is the umbilical cord. And to pause on the placenta for a second, the umbilical cord is what is connected to the placenta and into the baby via the umbilicus or the belly button. So that beautiful cord is absolutely essential to do all the things that we talked about with the functions of the placenta. That is going to allow that exchange from mama and baby to take place. And in the umbilical cord itself, there are 2 umbilical arteries and 1 umbilical vein. And it's all surrounded in this beautiful, thick white jelly called Whartons Jelly. And Whartons Jelly is amazing because it is slippery, but it's thick and it's fibrous, and it is going to protect those vessels within the cord. And there's even something called a true knot that can happen with this umbilical cord, where baby is small, they're doing flips and inside the uterus, and they're just having fun doing somersaults. And they can actually knot the umbilical cord. Sounds a little scary, right? It's actually not. It's really incredible. So with the protection of this Whartons Jelly, it allows the cord to kind of go, the knot itself to move up and down the cord while not compressing those arteries and the vein. So the Whartons Jelly on the umbilical cord itself is extremely protective. And once again, I will always refer back to nature's design, that this stuff, everything about the human body and everything with birth and pregnancy and the design of it all, it's just exquisitely designed, and the umbilical cord and the placenta are just a part of that. Okay, so the fetal side is the shiny side, the tree of life. It's beautiful. The other side of the placenta is the maternal side, where it's a little less attractive. It's gonna look meatier. So the maternal side, I'll show you right here, looks a little bit beefier. It has a bunch of different lobes on it. It can grow up to 35 different lobes there. And what that means by maternal side is that is the side of the placenta that is going to firmly attach on your uterine wall. Okay, so that's what's allowing your blood to exchange with the placenta, and it is on there really nice and good on that maternal side, hence why it needs to look a little bit more rough, a little bit, not that shiny, glistening side. It's gonna look a little more tough because it has to be. It's really gonna attach well on the uterine lining for you and for baby, of course. So, and then also, attached to the placenta is the amniotic sac. So I wish I had a better, I don't have a model, unfortunately, but the amniotic sac is also attached to the placenta. It's like a whole thing. So this isn't not showing the placenta in it, but it is a decent reference. So let's pretend the placenta is up here. This whole outer lining is the amniotic sac, and it is attached to the placenta. And with the amniotic sac itself, there are 2 layers, which is a fun fact. I don't think people really think of that. So it has 2 layers. It's the amnion and the chorion. So that makes up the amniotic sac. Within the amniotic sac is the amniotic fluid. So throughout your pregnancy, the amniotic fluid is gonna give your baby that buoyancy, allow them to grow and move. They're floating in there. They eventually practice swallowing, where they drink the amniotic fluid and pee it out. Drink it and pee it out. So that is a fun fact. So that is the basic anatomy of your placenta, the amniotic sac and fluid, and the umbilical cord. So let's talk for a second about the placement of your placenta and why you should just be aware of. It's not something to get super concerned about unless it's one specific case, but I do think it's helpful to just know the location of your placenta. So the placenta can attach to the anterior wall of your uterus, meaning the front side towards your belly, the posterior wall, think towards your back, the fundus, which is the top of your uterus. It could be on top, or it could be lateral on the sides. Okay, so anywhere that seems great for the placenta, it will attach to that uterine lining and find itself at home where it will be throughout your pregnancy. So anterior, posterior, fundal, or lateral. Another one that is important to note is a low-lying placenta or a true placenta previa. So if you watch my cervix video, you know, let's say this is the internal os of our cervix, meaning it's the opening. If the placenta is close to that opening, that is considered a low-lying placenta. Why do we need to be aware of this, and what are some of the concerns? So if it's low-lying and it is not blocking any of that os, most likely as your pregnancy progresses, the uterus is going to grow, and because of that growth, the placenta almost appears as if it's moving. But it's basically getting dragged up the side of your uterine wall, and it's going to get out of the way of that internal os. This is what we want, because we want the uterus, or you want your cervix to have the space that it needs to open and dilate without interfering with the placental innervation at all. Meaning you don't want the placenta to be close to the cervix at all, because that can cause detachment of the placenta, bleeding, and it could be an emergent situation. So if you do have a low-lying placenta, sometimes it'll be diagnosed, and then later in pregnancy you'll get another ultrasound where they will track and see where the placenta is, if there is enough room, enough centimeters that will allow for normal dilation to take place and allow the baby to come through. In the case of a true placenta previa, say this is my internal os of the cervix, the placenta is completely covering that opening. In that situation, when the placenta is covering the internal os of the cervix, this is definitely a case where your practitioner, in this case your OBGYN, would recommend a cesarean section, because you will not be able to have a normal natural vaginal birth. Because, for obvious reasons, the opening is going to be blocked, and if dilation started to occur, it would start to cause placental detachment, which could be a very serious medical emergency where you would lose a lot of blood and cause risk to you and your baby. So if you have a true placenta previa, you will be recommended for a cesarean section birth. In other cases where the placenta is, it's not as big of a deal. I do want you to know that if you have an anterior placenta, once again meaning the front surface of that uterus, you may not notice the baby moving as early in pregnancy. Why is this? Well, generally women will start to feel their babies moving around 16 weeks pregnant. Those are called quickenings. And if you have an anterior placenta, baby's essentially kicking into a pillow, right? So if they're kicking in front and you have an anterior placenta, that placenta is actually acting as a little bit of a cushion. So you may not actually feel that the baby is moving. No problem, there's no issue with that. It's just important to note that, I'm not really feeling any fetal movement yet. If you have an anterior placenta, that helps you clue things together of why you might not be feeling baby moving as early in pregnancy. Later, as pregnancy progresses and baby gets bigger and bigger and those movements get bigger and bigger, yes, of course, you're gonna be able to feel your baby move, no problem. So now let's talk a little bit about finishing your pregnancy. We're getting close to labor and we're getting close to birth, and then baby is born. Okay, so obviously the most exciting part about all of this is that you get to meet your beautiful baby. And you've done the freaking hard work, because man, oh man, pregnancy, labor, and birth are hard. But I want you to be aware that after you've given birth to your baby, the job is not over. You still have to deliver the placenta. So what does that look like? Depending on the setting that you're giving birth, if you are giving birth in the hospital setting, you are most likely going to have a medically managed third stage, or afterbirth, or birth of the placenta. So what does that mean? This is considered active management of the third stage of labor, and this will include a small shot of Pitocin. Whether you've had Pitocin to induce or augment your labor or not, Pitocin is what is injected either via shot in your arm or in your thigh or through your IV. That Pitocin is going to help clamp the uterus down faster and harder, and essentially expedites the speed and the time for the placenta to be born. And what I will say about active management of the third stage is that if you're planning a hospital birth, I do think it's important to talk to your practitioner about, because it's generally hospital policy, it's generally routine. But if you are planning a natural birth and you've had a beautiful, healthy, normal pregnancy and birth of your baby, why do we then need to intervene by doing an active management of the placenta? Something to consider. There are, of course, risks and benefits to all medical interventions, One being a decreased instance of postpartum hemorrhage, which is usually the biggest concern after birth. But you can ask your practitioner if you can just have a normal spontaneous delivery of your placenta without managing it, meaning without having that shot of Pitocin, without having that cord traction. So worth discussing with your provider to find out their views on it, if it's something that the hospital routinely does. Even if it is something that is routinely done, you can decline any medical treatment that you are not comfortable with. So that is something to note. If you are giving birth outside of the hospital, whether that's the home setting or birth center setting, depending on the midwife and depending on you, they may or may not talk to you about actively managing the third stage of the placenta, where they can do the same thing, where they can offer to do a small shot of Pitocin to help kind of allow the uterus to really clamp down and expel the placenta. With my second birth, that was really the only medical intervention I had where I did opt to get the small shot of Pitocin in my arm. So after my baby was born, the nurse came and gave me a small shot, and then I moved from the birth pool over to the bed, and that's where we awaited the birth of my placenta. But once again, many home birth practitioners, it may not be something that they really push. It could be something that you're wanting to do as a little bit of a safety net to help reduce any chances or risks of a postpartum hemorrhage. But once again, Pitocin is used to manage a postpartum hemorrhage. So if that were to occur, if you chose to have a spontaneous birth of the placenta without it being medically managed, if there was an issue with excess bleeding, Pitocin is still a medication that they have in their toolbox, if you will, that is going to help manage excess bleeding. So once again, person-to-person preference, discuss with your healthcare practitioner about what your options are, risks versus benefits in managing your third stage of labor. So for myself personally, with my first birth that I had in the hospital, I had a medical induction, so my system was being pumped with Pitocin my whole labor. So for me, it was not even mentioned at all that the delivery of my placenta was active management, which in hindsight, the more I've learned, it kind of peeved me that like this was never discussed at all, because I think it should have. That was obviously not true informed consent. But in hindsight, of course, it didn't make a difference to me because I was already being pumped full of Pitocin. That one more little boost of Pitocin, in my mind, wasn't going to make that much of a difference. I also had an epidural with my first birth. So when the birth of the placenta happened, truthfully, I hardly even noticed. I think my midwife was doing a little bit of gentle cord traction that helps encourage the placenta to detach from the uterine wall, and then it is born from there. What I do remember, I was snuggling my baby, my placenta was born, my midwife held it up for me. I wanted to thank my placenta for all of its amazing hard work that it did, and then that was the end of the story there. And in the hospital, generally, if you're not requesting to keep your placenta, they will send it to pathology, which may be one more thing to bill your insurance for, and then they consider it medical waste. And in some cases, you hear about hospitals selling placentas, but that is like a whole other thing that we're not going to talk about. With my second birth, I had my daughter at a freestanding birth center, an unmedicated natural birth, and I chose to keep my placenta. So I moved to the bed where we awaited my placenta to be born. And you're gonna start to feel some cramping and more contractions coming back. If you're unmedicated, you'll feel those contractions coming back. And those contractions are meant to help shrink your uterus down, to clamp down, and that's gonna allow your placenta to detach from the uterine wall because it kind of closes in on itself. And that detachment may cause a little bit of a separation gush of bleeding, and that kind of indicates to your provider that the placenta has detached, and then it will be born from there. So fun fact for me with my second birth, My placenta, I would consider it to be a little bit sticky, meaning it was not ready to be born right away. Generally, the placenta will be born 5 to 30 minutes after the birth. We were about 20 minutes and my placenta had not been born yet. So I was snuggling my baby on my chest, and I could tell my midwife was like, we're just kind of waiting on the placenta. There was no excess bleeding or anything like that. And I remember talking to my body, talking to my placenta, saying, thank you so much for serving me. You've done an amazing job, but it's time to let go. And mind you, I had gone through a miscarriage and then immediately into this pregnancy with my second daughter. And so it was a long 1-year process of being pregnant, a loss, and then pregnant, and then a birth. So for me, this was a very big moment where I needed to take a step back, come back into my body, thank my placenta for its amazing work. It brought me a beautiful, healthy, perfect baby, but it was time to go. It was time to release, and it was time to come out. So I stood up and my midwife held a little bowl beneath me, and I squatted my placenta out. It came out, and I will tell you, it is not painful because you are not birthing a baby that has bones. It's an organ that is soft, and in comparison to having given birth to the baby, the placenta itself is going to feel small. So after the birth of my placenta, it's like, you get a massive rush of oxytocin, you feel good, you feel relieved, you still have endorphins running through your system. So it is such a relief to close the chapter on birth once the placenta is born. That is done. It's done. You did it. You're freaking amazing. You're a rock star. You birthed your baby. You birthed your placenta. Like, hell yes. Hell yes. Amazing. So with my second birth, I decided to keep my placenta, as I said, and I did something a little crunchy, and it's definitely not for everyone, but I chose to because I was on this more natural, crunchy birth plan for my second birth. So I kept my placenta and I gave it to a lovely woman who was trained in all the things, and I had my placenta encapsulated. Essentially what that means is it gets cooked and dehydrated and ground up and then encapsulated in pill form. And then you take your placenta pills during your postpartum period. And I'm glad I did it. It may sound totally disgusting for some people, and that's totally fine. I don't expect people to be like, yeah, I wanna consume my placenta. But for me, I felt like it really did help with my postpartum mood. I had far less issues with baby blues. I had a crazy, effective milk supply. I had more energy, which are all some of the added benefits to encapsulating your placenta. So if that seems crazy and not your style, ignore it. But if that sounds like something you're interested in, I encourage you to do research in your local area to see who encapsulates placentas for you. I know there are some bigger companies that do it as well, where you can essentially send your placenta on ice to them and they'll send it back to you. So there are options if that's something that you're interested in. So that's that. I hope this was helpful. Please make sure to like and subscribe and share to any moms that are about to have their baby. And make sure to turn on your bell notification. That lets you know when I share new videos. I'm sharing videos every Sunday. And make sure to hop over to Instagram. My handle over there is birth_and_bloom_, and that's where I share information about the videos that I'm sharing weekly. I post reels and then share things to my story. So I hope you have a fantastic day. Thanks for watching, and I will see you in the next one. Bye-bye.